Now, this episode, we're going to be talking about health insurance for seniors. For the old people. So, let's get this show on the road, baby. You got your pen and paper? Because we're going to have to take some notes. But we ain't got number 5 questions. But, so you know you can't miss it. You can't miss it. You miss one, they're going to be, what, 80. So you can't miss 2. All right now, let's go. The guarantee of insurability option provides a long-term care policy owner the ability to A, buy additional coverage at a later date, or B, pay the same premium for life, or C, cancel the policy at any time, or D, add the insured spouse at a later date. Bob, I'm gonna go with A, Bob. Buy additional coverage at a later date for 50 points. Ding! Correct. That is correct. Take notes, everyone. Take notes. Okay, you done taking notes? Next question, then. Next question, please. Which of the following type of care is typically not covered in a long-term care policy? A, home health care. B, acupuncture. C, custodial care. Or D, skilled care. Bob, I'm going with B, acupuncture. Ding! Correct. Acupuncture is a service typically not covered in a long-term care policy. Next question, please. A reimbursement policy pays what amount of covered long-term care expense? A, actual covered expense up to the daily maximum. Or B, all expenses regardless of policy limit. Or C, a daily dollar amount regardless of the actual incurred expenses. Or D, the actual, customary, and reasonable expense regardless of the policy limit. Bob, this one I'm going to go with A because it makes more sense, Bob, for 60 points. Ding! Correct. That was correct. It said a reimbursement policy pays the actual cover expense up to the daily maximum. You got it? Good. Next question, please. Qualified long-care policies may take into consideration an applicant's pre-existing condition for a maximum of not more than blank months prior to the effective date of coverage. I remember reading it. It's D, Bob. 6 months. After 6 months, you can't do it. So, D, Bob. Ding! Correct. If a pre-existing condition waiting period applies, the policy must not include coverage for a pre-existing condition that occurred more than 6 months prior to the effective date of coverage. These conditions cannot be excluded beyond 6 months after the policy is issued. Correct. Under a long-term care policy, which benefit would be typically excluded or limited? A, home health care. B, intermediate nursing. C, alcohol rehab. Or D, skilled nursing. Man, I know this one. I'm going with C, Bob, for 500 points. Ding! Correct. Good job, buddy. Now, we only have 5 questions, and I think we got them all right, but ding! 100. I like those grades. Yeah. All right. See you next time. Get your smart ass.